Troy, thank you so much for taking the time with me today. Always great to catch up on where you're at with Particle Health. You know, I've had the opportunity to interview a lot of folks here over the last few days, and a lot of them say, if we could just get that interoperability piece figured out, then X, Y, or Z. And this is what you're tackling with Particle Health. So give me the flyover. What are you building at Particle Health?
So I think interoperability is a weird word. Everybody has a different definition for it. What I've learned over the last 3-4 years of doing this is that there's kind of two pieces. One is actually having access to the data, which is a huge issue. It's super hard, and in some areas of healthcare, that's basically been solved. Today, we have access to over 300 million people's medical records, one API. We're finding records about 90% of the time through our API, and we're finding about 95 records per patient per search. So like, we can get access to almost everybody's medical records through one API today. That's happening right now. The other piece of interoperability, which I think is harder, is actually taking that crazy amount of information that we're finding and putting it into a place that actually has value. So it's one thing to get 95 records on a patient, but it's another thing to get exactly that medication you need to know about to help treat that patient quickly and effectively and keep them out of the hospital. So there's two pieces of this puzzle, and we are starting to see cracks in the first piece. The second piece I have not seen a lot of success in other places because it's so new.
Yeah.
We haven't had access before, so now everyone's saying, okay, now we have access. We have a whole nother issue here, big challenge ahead of us, which is what we're working on at Particle.
Got it. One thing I love about Particle is that you're creating an ecosystem for more innovation. Obviously, you're an innovative company yourself, but talk to me about the sort of developer-friendly platform that you've created for additional apps and programs.
Yeah, so the integrations that we've done behind the scenes took us 2+ years to get right. It's one of those things where, you know, it doesn't matter how many cooks you have in the kitchen, you're still going to bake a cake in an hour, right? It just takes a long time to get this right. And so what we've been really focused on is how can we simplify this down as much as humanly possible? And so our API today is just putting in someone's name, date of birth, address, phone number, and gender, and then pulling out their medical records. We've basically consolidated it and simplified it down to 2 steps, a post and a get. And so that's huge. That's what we really have to focus on, right? Is like, if you're an entrepreneur in a garage and you have this next big idea for something in healthcare, you should be able to come to our website and start going within an hour, not have to do 3 years of integrations.
Yeah.
So that's really part one of our value proposition.
What are some of the use cases that you're most excited about?
So most of the use cases that we work against today are under this kind of like risk management framework. It's really value-based care. For our customers, what's really important is when a patient walks through the door for the first time, that doctor already knows that they have diabetes, that they're on metformin, that they haven't had a dialysis appointment in 3 months, that their last A1C value is out of range, and they already have that care plan ready to go, as opposed to taking 6 months to figuring that out. And that is a huge value for everybody because the doctor is providing the best care possible and getting paid for it. The patient is getting healthier and isn't deteriorating because of some lag of information sharing. And the entire system saves a ton of money because the patient doesn't show up in the ER.
So you're making that data accessible. How does it then get translated to the physician in an actionable way?
So this is a big deal. I talked a little bit about the first problem being access, the second problem being value. The middle step of that, which I didn't really talk about, is taking all the crazy amounts of data that we're getting in a variety of different formats, typically CCDAs and XML, nested XML documents, and breaking it into little pieces, and then making those pieces searchable for developers and providers. So with our API, you can say, give me Bob's last 5 medications that he's been prescribed, or give me Bob's A1C values that have been out of range. I don't care about the ones that are in range.
You can use Particle's API to do that kind of query.
You can search against a person's medical record for specific things and ask it specific questions.
Okay.
So that's where you start building use cases of, I have 10,000 patients that are, you know, diabetics. Hey, Particle's API, which ones are getting sick? Which ones are high risk? And I'm going to spend my time and my money keeping those people out of the hospital. So getting that really, allowing our API to be able to answer specific questions is really, really important. So you're not digging through files and no one's going to do it.
Yeah, I know you're enabling a sort of an ecosystem of innovation, but who are your sort of typical larger clients, enterprise clients? Who are you working with?
So we work with 2 types of organizations. One are like end users. So accountable care organizations. We have a few ACOs as customers. The ones that move faster and do more novel things are the technology services that support those end users.
Okay.
So there are chronic kidney disease platforms, there are diabetes apps, there are telemedicine companies and digital pharmacies that use Particle. And they are doing these value-add services that, with data, make their product better.
Yeah. What gets you the most excited when you're at an event like this and you're sort of seeing the whole sort of innovation ecosystem all in one place?
It's funny because every conversation I have results in like a discovery of how Particle could help them, and it's very rare that a conversation leads to a dead end.
Yeah.
There's so many organizations here right now that could all use data to make better decisions and keep people out of the hospital and keep them healthier and happier. And it's just a matter of time before everybody starts adopting this. Like, we've seen one customer come to Particle, and then their competitor came right after that, and then their competitor came right after that, and it becomes a competitive disadvantage not to have access to this data. So we see this snowball effect of, oh, they're doing something faster, better, stronger now because they have real-time data, and so we have to do that too. So it's been kind of interesting to see that snowball effect take over, and I think within the next 3 or 4 years, everybody's going to be connected to networks and exchanging data.
What does that mean for Particle Health over the next couple of years? How do you see that growth trajectory?
So there's kind of two main things that we're focused on. One is access to more data. Right now we have basically critical mass on EMR clinical data. We have partnerships for pharmacy data. We have partnerships for provider data. And we're now looking at claims and IoT and genomics and the whole kit and caboodle.
And each of these is a separate sort of enterprise relationship where you say, okay, this is how we're going to access your data. You set the whole exchange up.
So we see it as, in a simplified way, there's data holders that hold this information and data seekers that need it to do things. The data seekers are our customers and the data holders are our partners. And what we do is we take their data and we package it and clean it and we put it wrapped up against our really, really simple API. And so for them, some of these groups don't have APIs, and now they can have one with Particle. And then our customer base will pay for it. Yeah. So it's a really good kind of win-win relationship.
Any specific milestones you're particularly excited about, looking forward to, looking at the next year?
We just closed a couple of our biggest deals, and I'm hoping to make those announcements soon. Nice. I wish I could do it now, but they are super exciting.
It's always how it is when you're moving fast. There's always something you can't talk about.
The amount of patients we're going to impact is going to like 100x over the next couple months, and that is super exciting for us.
That's cool. Troy, thank you for taking the time with me. It's always exciting to see how you're growing, how you're expanding the reach. I can't wait until I have more access to my patient data thanks to APIs like Particle Health. So thank you.
Thank you, Logan.
All right. Be well.